my name is Danielle, and this is my video presentation of my pocket guide assignment for Nursing 629, Advanced Health Promotion and Disease Prevention. So I'm currently on the Family and Nurse Practitioner track, so I tried to include entries and high-yield topics that would be most beneficial to me and stuff I will definitely see in the clinical setting and information I can easily refer back to. So for this assignment, I organized my pocket guide in a 3-ring hole binder, just personal preference and works best for me. In my binder, I just included some dividers to separate the topics for organization. So in my first entry, I included a preventative health history and immunization entry. I included core components of a health history exam, and an immunization assessment, and I have the adult immunizations in here and a pediatric immunization schedule, which is something I feel like I could always use a reminder on. I inputted a little table here of the pediatric immunization schedule from birth to 6 years old. I included a section on immunizations in pregnancies, and then some contraindications and precautions to certain immunizations. And at the end of every entry, I just included some bonus information and some clinical pearls. My next entry was on medication reconciliation. I included a step-by-step process on how to obtain medication history. Then I included patient education and high-risk patients. I also included the BEERS criteria, the stop and start criteria, for identifying polypharmacy and safe indications to start medicines or indications to stop inappropriate medications. On my adult health entry, I included one on hypertension. I included the blood pressure classification according to the ACA and AHA guidelines, initial assessment on hypertension and risk factor identification, the management of hypertension, the diagnostic and lab workup, and the pharmacological management. And then just some complications of uncontrolled hypertension. My next entry was on diabetes mellitus. I mainly focused on type 2 in this entry. I included diagnostic criteria, what's considered pre-diabetic, the initial assessment, baseline evaluation, then the management of type 2 diabetes, first line, and then second line, jumping to medications, pharmacological management, the first line and second line drugs, what we would want our patients' glycemic targets to be, complication of diabetes, monitoring and follow-up, and patient education. I included hypoglycemia management and some clinical pearls. I have a small section on asthma and COPD, just identifying the key differences. And I have a medication diagram printed out, but it printed very lightly. It might be hard to see on camera. Then I included asthma management with the step 1, step 2, step 3 algorithm. Then I included asthma medication classes and just exacerbation treatment. Then on my next section, I just did a quick blurb on STIs I might see in the clinical setting. I included the key components of an exam, the course and common symptoms to assess, and then different clinical presentations for some common STIs. I included chlamydia, gonorrhea, HSV, human papillomavirus, bacterial vaginosis, syphilis, and different yeast infections. On my next entry, I did one on women's health. I included a routine screening exam, contraception quick guide with different methods and different medications. And then I included just a quick blurb on estrogen contraindications. Then I have a vaginitis comparison table, and then common gynecological conditions, and then pre-contraception and prenatal basics. Then I have on the other side just common lab interpretations, red flags, and menopause management. My next entry on women's health, I included abnormal uterine bleeding. I included the immediate assessment. I included the palm coin system to identify if it's structural or a non-structural etiology. Then I have associated conditions, diagnostic lab workup, imaging and further evaluation, management options for acute versus chronic abnormal uterine bleeding. Then I have long-term management, red flags, and patient education. And then once again, like I said, a quick blurb, extra information with some clinical pearls at the end of every entry. Next on women's health, I focused on OB high-risk pregnancies. In this entry, I focused mainly on advanced maternal age. I included why it increases risks in advanced maternal age to the mother and the fetal and neonatal, infant, prenatal screening and diagnostics, and then other high-risk pregnancy factors. And then I just included monitoring and some patient education. And some clinical considerations and clinical pearls. My next entry is on pediatrics, as I will see the kiddos in the primary care setting, even though I'm mainly focusing on older adults in this pocket guide. I included core components of a well child visit and what you should assess in every pediatric visit. I included the growth and development monitoring and the developmental milestones, which is something I could always use a refresher on, and they are so important to assess. So I have from infant to school age in this entry, and then I have some red flags for developmental delay and some important information on pediatric safety counseling for the caregiver and the patient. I included a quick entry on mental health in primary care, as I realized like most patients seem to go to their primary care provider first, as it's more comfortable than a psychiatrist or someone in the mental health setting. So I included routine screening tools and then some quick blurbs on some common mental health conditions, such as major depressive disorder. I included some symptoms, some diagnostic criteria, and then first and second line treatments and non-pharmacological treatments you can refer the patient to. I also included generalized anxiety disorder, also included the symptoms, treatment, quick overview. Bipolar disorder, substance use disorder, and then a suicide risk assessment, and then non-pharmacological management. Then once again, just some patient education and some bonus information. I then included a quick entry on dermatology. I just included some common rashes and a comparison table, bacterial skin infections, some fungal infections, red flags, and a quick guide on topical steroids. Then at the end of my pocket guide, since I already had this printed out, I just included my notes from my advanced pharm class. I know it's not part of the project, but I just thought it'd be helpful to have. It has all the medication classes and the algorithms to prescribing in here. Then at the very end of my pocket guide, I just added my references. And then I threw in a empty notebook just in case I want to jot stuff down to print out and add to my pocket guide when I learn them in the clinical setting. And that is my assignment. Thank you for watching.